Hi, today we are going to read about the eye. Eye is a sensory organ through which light will pass, and that sensory input which we are getting through the sight or vision, that is more than 80% of our sensory input that is going to our brain. Okay, so now shape of the eyeball, it's not a spear. Okay, it's a oblate squashed spheroid, equatorial, where equatorial radius is more than polar radius. Okay, then shape of cornea, this is a prolate ellipse where the polar radius is greater than the equatorial radius, or in usual terms we can tell it is a pointy structure. Okay, so what does it mean? What is oblate and what is prolate? We'll learn now. Now we'll learn about what is prolate and what is oblate. So this is a normal sphere where our radius, equatorial radius, and this is polar radius. Okay, so equatorial radius will demarcate as ER, polar radius is PR. Okay, so for sphere, ER is equal to PR. Here this is the equatorial radius, this is the polar radius. Here what is happening? This ER is more than PR. Here again we'll see. Okay, so this is ER, equatorial radius, this is PR, our polar radius. So here what is happening? Here our polar radius is more than equatorial radius. So these are different scenarios where we are reading about the equatorial radius and polar radius and comparing them. So if both are same, it is a sphere. If equatorial radius is more than polar radius in this say structure like condition, it is known as oblate. Oblate. When polar radius is more than equatorial radius, it is known as our prolate. So which structure is what? Prolate is cornea. Actually prolate ellipse. Oblate, our eyeball is oblate squashed spheroid. Got it? So these two have to remember. Now we will read about the anatomy of the eye. Anteriorly, what we are seeing, the transparent structure is cornea, through which light rays will pass and will go to, light rays will pass through cornea, then lens, then vitreous, and it will fall on the neural retina. So this is the neural retina. Neural retina contains photoreceptors. Now on the transmission of the light, so many other structures we are seeing. Out of them, one is anterior chamber, which is filled with clear aqueous fluid, aqueous humor we'll call this. Then iris. Iris is a part of uvea, the vascular coat of the eye. Okay. The anterior chamber angle, which is an angle between our cornea and the iris. Then posterior chamber, which is present between the lens, and this is the lens and this is the iris. In between space is there, that is known as posterior chamber. Then ciliary body, which is also a part of the uvea, is having attachment to the lens via zonular fibers. Okay. Now ora serrata is present here. There is a serrated structure in this cross section that demarcates the end of the retina. Then choroid, it is demarcated here. Okay, that is also a part of uvea, and sclera, which is protecting the all these structures. This is the vitreous cavity containing vitreous. This is also a transparent structure. Now, one thing we can see inside the disc, that is known as optic disc, through which fibers are going to pass to the optic nerve. So, the dimensions we will read now. Here, anterior chamber depth is 3.11 mm. If it is becoming less than 2.5 mm, the risk of angle closure glaucoma is more. Then anterior anterior posterior length of the eyeball is 23 to 25 millimeter. Transverse length is 24 mm. Okay. So here we'll read dimensions and contents of the adult eyeball. Anterior chamber, where average depth in an emmetropic or normal eye is 3.11 mm. Below 2.5 mm, the risk of angle closure increases. Posterior chamber depth is 0.252 mm. Vitreous cavity is 16.5 mm. Eyeball as a whole is of length 23.5 mm. Range is from 19.5 to 26.5 mm. Volume in the anterior chamber is 220 microliter. Posterior chamber is 60 microliter. Vitreous cavity is 5 to 6 ml. Total volume of the eyeball is 6.5 to 7 ml. Contents of the anterior and posterior chambers are aqueous humor, vitreous cavity, vitreous. Now we can divide the eyeball into three concentric layers. The outer protective layer, that is the corneoscleral layer, middle vascular layer, the uvea, and the inner neural layer, the retina. The outer protective layer, the corneoscleral layer, composed of the collagen to protect our eyeball. Cornea appears elliptical because the sclera and the conjunctiva overlap the cornea anteriorly, slightly more above and below than medially and laterally. The main purpose of this corneoscleral layer, the outer protective layer, is to protect the internal ocular tissues. Middle vascular layer, the uvea. It consists of the choroid, the ciliary body, and the iris. It is a highly vascular structure. Function is nutritive and supportive by supplying oxygen to the outer retina and producing aqueous humor. In a neural layer, the retina, it is a photosensitive layer, contains photoreceptors. Thank you.